Coming of Age is coming up next. I'm your host, Josh Newby. A lot has changed in the past month, and with the disclaimer that a lot may change in the next month, we're going to do our best on this show to bring you important local news and information regarding Northwest Florida in the midst of the unprecedented coronavirus pandemic. We've got resources from various perspectives in the community, so stay tuned. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll feel empowered to regain your freedom while retaining what makes you, you. We've been in the community for nearly 50 years, advocating for elders and supporting those who care for our parents and grandparents. We were there when your father's health began declining, when your mother needed companionship during the day. And guess what? We'll be there down the road when you need those services too. Now, join with us as we talk together about the aging issues that matter to you. COVID-19, also known as coronavirus, is all over the news. This highly contagious virus is making its way across the world, including the United States. In fact, if I told you right now the number of people who have been infected will have changed an hour from now. COVID-19 is very serious, and its impact is and will be widespread. But you can take steps now to protect your health and that of your loved ones. Today, Dr. Paul Glisson is with us via FaceTime to talk about those precautions. Dr. Glisson is Chief Medical Officer and Vice President of Medical Affairs at Baptist Healthcare and stands on the front lines of the fight to contain COVID-19. Doctor, thank you so much for coming on today.
Thank you for having me, Josh.
So to start, give us some information about COVID-19, what it is, why it's so contagious, etc.
Well, it's a respiratory virus that is based on the engine of the coronavirus, which is that same engine that the virus uses to be in the common cold. So that's why it's so common around. But this is a new form that we've not seen before. There's been a mutation of it, and it's obviously way more contagious than the regular flu virus, and in some cases has had a higher mortality rate.
Gotcha. I know speculation around this next topic has evolved quite a bit, but I'm curious, who is at the greatest risk of becoming infected with COVID-19?
Well, our initial thoughts from the early onset sites, such as China and Italy, were that mainly our older folks were more at risk,
right,
being 65 years old, but that's not been written in stone. There are certainly younger patients we're seeing who have had very severe symptoms as well. Obviously, if you have chronic lung conditions or things such as asthma or heart disease, those would put you at higher risk as well. We think that the virus affects some receptors in your pulmonary and cardiopulmonary system that could also be affected by chronic heart conditions as well. So.
Now, does everyone who gets this virus get sick and then need to subsequently be hospitalized?
Right, that's a great question. It looks like about 80% of the people have very minimal symptoms. When I say that, I mean, obviously no one wants to have the flu and have a fever and lay in bed for a couple days or feel under the weather, but they're not hospitalized. And that's one thing I've seen young people say is like, I don't care if I get it, I won't have any symptoms. But I can promise you, even those who have mild symptoms are not happy about it. So I would not recommend being cavalier about it. But we are seeing less than 20% of the people having to be hospitalized. And I'll tell you, I'll share some data for our area here in Pensacola. We're seeing higher than expected numbers as far as people who are infected by it. But then the hospitalization rate has been lower here in Pensacola so far. It's certainly, we're very early into this epidemic, but the hospitalization rate has not been as high as it has been in other places. So we're seeing, around less than 15% of the people having to be hospitalized, and certainly about 5% has been pretty standard that those patients who require ICU coverage or intensive care.
So speaking of those signs and symptoms, what do some of those look like, at least in the early stages?
Well, from the CDC guidance, as they've gathered evidence from around the world, the very classic symptoms are a high fever, certainly greater than 100, cough, and shortness of breath. We're hearing anecdotal reports from places like New York and New Orleans that they've seen patients who show up with something they did not think would be, coronavirus, such as nausea and vomiting, and end up those patients have had mild respiratory symptoms with it. So, and then having abnormal X-rays and testing positive for it. But overall, I'd say those are anecdotal, and so I'm not putting a lot of clinical evidence behind that and saying that's definite. What we are looking for is using our screening tests are fever, cough, and shortness of breath.
So what do I do if I develop those symptoms? What should my next steps be?
Well, certainly you should, number one, ask yourself, are you sick enough to where you would go to the hospital, no matter if it was coronavirus or not? So answer that question first. And that answer is yes, I'm so short of breath that I can't walk outside or I can't get out of bed or those type of things. It doesn't matter about being tested or not being tested. It doesn't matter if you're positive or not positive. You should call 911 and get help. So put the symptoms first and say, am I sick enough to be in the hospital? And if you answer yes, seek appropriate care. If you're not sick enough to be in the hospital, but you're worried about being tested or being contagious around other family members, and I have a lot of patients who say that, I have mild symptoms and I'm okay, but I live with my 90-year-old grandmother, and, I don't want to get her sick if I am positive. So those are certainly relative questions. So my first advice would be to contact your primary care doctor and discuss your symptoms with them. I know for Baptist Healthcare, we have an online screening tool that you can use off our website that would tell you if you should be at further testing or not. But also, if that's not available with your primary care doctor, you certainly can call and discuss it with them. If you don't have a primary care doctor or someone you can call to have those screenings tests done, there are community resources here, both from Sacred Heart Healthcare System as well as from Community Health Northwest Florida, which has done some mobile testing as well. So I would encourage you to reach out to them as well if you're not a Baptist already employer or a patient. We also have our urgent cares that are available for screening as well. I do want to point one more thing out, though, is that if you do come in and you're having symptoms, it's always a good idea to call ahead and get specific instructions from them, because they change every day just about it. It seems like we get new guidance from the CDC or new guidance from our state Surgeon General, Dr. Rickeys. So call ahead, let them know you're coming, and they'll give you the latest guidance and also be prepared for you to show up.
Yeah, that's great advice. How do I get tested for COVID-19? What does that procedure look like?
That's a great point as well. And you're going to hear a lot of different evidence and people talking about rapid testing and swab testing and blood testing. So let's talk about that for a second. Right now, the most accurate way for us to test if you are actively having the disease is by PCR testing, and this tests for the actual virus on your body. So we do swabs, and there's different kinds of swabs you can do in the nose, in the mouth, or as a sputum sample. Right now, the CDC has given changing guidance on that just about every day, so there's no need for me to tell you what the current guidance is right now because it'll change. But it's usually a nasal swab, just like we test for the flu. They go as deep as they can and get as much mucus and stuff on that, and then test that for the actual virus DNA. There are different turnaround times for that and different labs that do that. The state certainly has a program set up for that for state testing, and that's a couple-day turnaround. There are private labs such as LabCorp and Quest which are doing testing, and they've been inundated with testing, so they're multiple days behind. So it's not like something you get back right away. Our local labs here, in conjunction with Sacred Heart, and I just want to give a big shout out to Sacred Heart, who's done an enormous favor to our community and just really stepped up for testing in our community to make their in-house lab available for us to do just one-day turnarounds. And they've certainly stepped up to make those testing results available to us, which has helped us a lot with inpatient testing to get those most critical patients turned around as quickly as possible. That's not been available for community testing in the local clinics, but so most of those are going to an outside lab. And I'll just say one more comment about other rapid tests you may hear about. A lot of those tests for antibodies, for IgM or IgG antibodies to the virus. So those are not as helpful for us to treat an actively evolving clinical presentation. So if you come in right now and say I have a fever, you may or may not have developed antibodies to that. If you think about it, that's your body's defense system against the virus. So I could have an active infection right now, but have not had time for my body to make the antibodies to fight the virus. So if you test for the antibodies right now, that does not mean you don't have the virus. So you will see a lot of companies offer at-home testing kits that are available online that do antibody testing. And I'll just warn you and say, I'm not sure what clinical significance that would have for us. The fact, it's just telling you that you have mounted the defense to the virus. So it could mean that you had the virus 2 months ago and you still have those antibodies around. So we don't guide current treatment by antibody status. So,
Okay.
so I would just say make sure if you're getting tested, it's important you find out the results. It's not just antibodies, it's the actual PCR test.
Yeah, no, that's a good point. I mean, we've heard a lot about this, but maybe just reiterate, how do I protect myself? How do I protect my family?
Well, this is a respiratory droplet disease, best we can tell. So it comes from sneezing, coughing, wiping your nose, wiping your mouth, touching your face and your hands, and then spreading that to either direct inhalation to other family members or people. So we found that the virus does stay alive on surfaces for several days if not cleaned, especially metal surfaces. So we'll recommend that you wash your hands often with soap and water and avoid blowing your nose and coughing, sneezing. We've seen a lot of patients wearing masks, and I think if you're having symptoms, that's probably a good idea to wear a mask to protect others from you, not necessarily to protect you from others. So that just, number one, keeps your hands away from your face and your mouth. And also, if you do sneeze or cough, that it keeps that inside the mask, keeps it from spreading. So soap and water and avoiding contact with your face and hands is number one by far. And we also recommend social distancing and just staying away from that 6 feet perimeter around you so that you can't spread those droplets to other people. And then isolate yourself if you are feeling sick, and especially from those who we talked about who are at higher risk.
We have just about a minute left, but I wanted to give you a chance to answer this question. What is Baptist Healthcare doing to prevent the spread, and where can people get reliable information?
Correct. For the information, we have funneled all that through our website, ebaptisthealthcare.org, and we have a special COVID-19 section on there to get the latest updated information. If that's not answering your questions, the cdc.org website has a plethora of information that's updated several times a day, and that's very accurate. So we recommend those two websites as the source of truth. As far as what we're doing here, obviously we're trying to walk the fine line about getting patients care, at the same time not putting our patients at risk for catching the disease here. So we're implementing screening protocols. So when you come on campus, they'll have those before you're allowed on campus. And we've also restricted our access so that we can make sure we screen everybody when they come on board. We've restricted visitation too, so only required visitation is allowed here. Obviously, if you're having a baby, we want you to be there, mom and dad be together, but if you don't need to be up on the floors visiting and putting our other patients at risk, we want to restrict that as much as possible. And then we've also restricted elective surgeries and really doubled down on education and outreach to our community.
Excellent. Doctor, great information, obviously an ever-evolving situation, but I thank you for joining us today.
Thank you, Josh. Stay safe.
Next, we're covering the economic effects of the coronavirus and how local businesses and consumers can help. Stay with us.
Why do people love ACT's retirement life communities? There are more reasons than just the active lifestyle. Like ACT's Life Care, a plan that protects your nest egg with predictable monthly fees, even if your healthcare needs increase. So you can enjoy a carefree today and a worry-free tomorrow. Plan a visit and see why our satisfaction rating with current residents stands at 98%. ACT's Retirement Life Communities, where loving kindness lives.
1 in 3 adults has pre-diabetes. That means it could be you. Your barber. Your barber's barber.
Nice work. Thanks.
With early diagnosis, pre-diabetes can be reversed. Take the risk test at doihaveprediabetes.org.
What does it look like when a life is truly changed?
I feel a sense of accomplishment because I built a house. This house has brought us financial independence.
It's a great place to raise a family.
Strength, fuerza.
When I look back where we've come from to where we are today, it makes my heart very happy.
Potential.
Potencia.
For me, this house means all of us together
Fuerza.
Security.
Security.
Every family dreams to have their own house. This house changed our lives.
Habitat for Humanity is at work in your community and around the world. Through shelter, we empower.
While we've been told the immediate health effects of the virus can be mitigated through proper hygiene and social distancing, it's the long-term economic effects that have many more people worried. Northwest Florida specifically was experiencing a boom of industry in the last couple years before the virus hit our shores. So what does this mean for the businesses you frequent, the job you work at, and of course your pocketbook? The Pensacola Chamber joins us to discuss right now. Sarah, thank you so much for coming on today.
Josh, thanks so much for having me.
So to get started, I mean, what is the Pensacola Chamber? Just give us that 30,000-foot view first.
Yeah, absolutely. So the Pensacola Chamber of Commerce, we like to think of ourselves as kind of the convener of the business community here in Pensacola. So we have about 1,200 members of the Pensacola Chamber, and our mission is to connect those businesses with resources as well as promote the local economy the best that we can. And so we do that in a variety of different ways. Mm-hmm. And so we just love our business community, and we love to be there to support our businesses the best that we can.
Absolutely. Yeah. So tell us about the Chamber's response to local businesses regarding this virus. I mean, sure. I can only imagine being a business owner right now.
Sure, absolutely. So the Pensacola Chamber of Commerce actually serves as the lead organization for business and industry for the local EOC. And so, of course, when the emergency got activated, we were right there front and center trying to do what we do all the time, which is to connect our businesses with those resources to get them through this period. Mm-hmm. In addition to that, we are using our social media like we never have before, right. Just trying to engage. We've created 2 Facebook groups specifically geared towards our small businesses. So we have the Pensacola Takeout and Delivery group, which right. now has just reached 15,000 members. And that is just to connect our citizens here in Escambia County with where to go for different takeout options and availability for our businesses. And so they'll post on there the different offers that they have. We also have a similar one for our retail small businesses. And so just trying to give them a platform to share what transitions that they've implemented in order to continue business, but just following the new guidelines that they're restricted to. And so that has proven to be a great resource for our small businesses. We also have partnered with the Florida Restaurant and Lodging Association for the Save Florida Businesses initiative. Mm-hmm. And what that is, you can go to savefloridabusinesses.com, and if you're a small business, you can post gift cards on that website where people like you and me could go on and purchase a $75 gift card for $100 worth of goods and services. Okay. And so that revenue goes immediately to these businesses, but the goods and services aren't able to be taken advantage of until after May 1st. Okay. And so it's just trying to incentivize some more revenue for our local businesses during this time to help them get through. And so we've seen a lot of success with that initiative as well. And then every day doing our Facebook Live videos with right. different leaders in our community and different sectors. And Josh, thank you so much. You came on last week and talked about your agency, and so we were very thankful for that. So just trying to keep them engaged, keep those resources, keep them connected to those resources at all times, and just try to keep them updated on the information as we get it. So
I mean, there's going to be some detrimental effects,
sure.
right? I mean, inevitably. Sure. What is the Chamber's advice to local business in terms of either how to, sort of shorten the timeline of some right. of those long-term effects, or maybe mitigate those effects? What do you say to those business owners?
Well, obviously, right now, the number one thing we're trying to encourage is innovation.
Sure.
And one of the fortunate things that does come from a crisis like this is that we do see people being more innovative. Mm-hmm. And so we're encouraging people or small businesses specifically, to have a plan, be innovative, look at different ways that you can continue to conduct business, that you can continue to engage your clients and your employees, but just on a different platform or a different method. And so we're encouraging them to do that. We're also encouraging them to know about the loans that are available to them during this time. So the loans, the Florida Disaster Bridge Loan and the SBA Small Business Disaster Loan are the two that we're really trying to get people to take advantage of it during this time to kind of get them through that short term.
Sure.
Loss. And so knowing about those loans and knowing how to apply for them is also a great way for them to kind of aid throughout this time.
Right.
So.
Talk about it from the consumer side, because I don't own a business,
Sure,
right?
sure.
But I want to support my local economy.
Yes.
But there again, almost everything, it seems, has been shut down.
Right.
So what do you say to the regular citizen who is trying to keep an eye on their finances,
Right.
but B, also wants to support local businesses?
Right. So I would say if there is a good or service that you are in need of, obviously you're going to spend that money if it's a need of yours. And so our encouragement to the community is to shop local as much as possible. So if it's the option of going to McDonald's or going to a local restaurant joint, hamburger joint, support that local business, because that revenue does, the majority of it does come right back here to support our local employees and our businesses, and also keep building those relationships and connections. And so our main encouragement is just shop local as much as possible. If you are going to, have to purchase a good or service, and we realize, this is an uncertain time,
Sure.
so we don't know what is next. And I know, people are not wanting to spend money if they don't have to, but if you are, then definitely shop local.
Yeah, those to-go margaritas are especially helpful during this time.
Yes.
So what resources does the Chamber offer to struggling businesses during this
Sure.
time? Someone calls the Chamber, says, I'm a struggling business. What do you say to them?
So really our main go-to is to direct them to our website.
Okay.
Our team has done a phenomenal job at getting all of the resources available for all the different organizations on our website. We've got a COVID-19 landing page, and if you click on that, it will take you to a page where there's 4 categories. There's a resource page for businesses, for people seeking employment, for people seeking opportunities to help in the community, and also for people seeking health resources. And so all of those have a wide variety of links and resources on that page. And as people email us or provide those resources to us, we're putting them automatically on that page so that people can be directed there as kind of like a one-stop shop. So we definitely would encourage you to go to PensacolaChamber.com.
Sure. Now, obviously, this next question, I'm sort of putting you on the spot here, is purely speculative.
Okay.
So that disclaimer. But how does the Chamber feel about the area's economic health in 1 year, in 5 years? I mean, even though it is speculation, it still helps to hear from the experts.
Absolutely. Well, I would say that this is not something that's new to Pensacola.
Sure.
Pensacola is prepared to handle disasters. We've done it before, and we know that our area, specifically our business community, is resilient. And I think with the great leadership that we have from our governor down to our mayor, we're going to see Pensacola bounce back probably quicker than most areas in our country,
Sure.
I would assume. It's going to take some time. There's going to be frustrations and some bumps along the road, but I think we're going to see a pretty quick recovery for this area, just given the collaboration and the proactiveness of our business community.
I mean, you're right. We saw Ivan, we saw the oil
Absolutely.
spill, we saw the recession, and you look back a couple months ago, and Pensacola was better than ever.
Sure.
So I think that's good speculation
Absolutely.
on your part. Last question for you. What advice, just sort of general advice, do you give to businesses during uncertain times, or business owners who may be feeling anxious during these, they literally don't know what's going to happen tomorrow?
Sure. And I would say this, and this is a phrase that we stole from the Florida Chamber, but what we've been saying from the start of this is follow facts, not fear. Make sure you're getting reliable resources and correct information. I know there's so much on the internet and on the news outlets, but make sure you're getting reliable information. Stay connected and engaged with your employees, with your clients, with your business and community partners. Make sure that you're continuing to develop those relationships as much as possible. Again, be innovative. Try to come up with additional opportunities to conduct business in the culture that we have right now. And then just also make sure that you're following the social distancing requirements and suggestions to make sure that you're safe and that your employees are safe at all times, and that we can get through this quicker.
I mean, a great byproduct of crisis is that it often forces innovation.
Correct.
Right? It forces
Absolutely.
us to think in new ways,
Absolutely.
hopefully that'll be the upside
Yes.
of this. Sarah, thank you so much for coming on.
Josh,
I appreciate you.
Absolutely.
And thank you for watching. Until next time, enjoy life. You've earned it.
Since 1989, TLC Caregivers has been providing the special help people need to stay independent in their own homes. TLC is an employer of choice in the home care market. Our employees are screened with level 2 background screens, drug-free, and have caregiving experience. If you have time, enjoy people, and are interested in joining us, go to tlccaregivers.com to learn more about becoming a TLC caregiver, or visit us in Cordova Square.
Part-time job, full-time hustle, all-time Shiro to all of us. You nurture, we listen. You teach, we thrive. You lift our spirits, but we've got to lay down the truth. It's time for you, our Shiro, to stretch for the stars. A free online chat can give you the personalized tips you need to start boosting your retirement savings today. Start saving more for retirement so you can feel prepared and live your life to the fullest. Visit aceyourretirement.org/Shiro.
We know that we're asking Americans to do a lot right now. So we're asking everyone to be selfless for others so that we can protect those who are most susceptible to this virus.
A question I often get asked is, why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
Social distancing is really physical separation of people.
It's what we refer to when we ask people to stay at least 6 feet apart.
Not going to bars, not going to restaurants, not going to theaters where there are a lot of people. It all just means physical separation so that you have a space between you and others who might actually be infected or infect you.
We all have a role to play in preventing person-to-person spread of this disease, which can be deadly for vulnerable groups. For more information on how you can social distance, please go to coronavirus.gov.
Part-time job, full-time hustle, all-time Shiro to all of us. You nurture, we listen. You teach, we thrive. You lift our spirits, but we've got to lay down the truth. It's time for you, our Shiro, to stretch for the stars. A free online chat can give you the personalized tips you need to start boosting your retirement savings today. Start saving more for retirement so you can feel prepared and live your life to the fullest. Visit aceyourretirement.org/Shiro.